There are many non-invasive techniques in acupuncture, as well as putting acupuncture needles or using moxa to heat up the acupuncture points. And some of these non-invasive techniques are techniques which may or may not be as good as using an acupuncture needle. Clearly, if non-invasive techniques were all as effective as the invasive technique of acupuncture needling, probably most people wouldn't use acupuncture needles. But because acupuncture needles work so well, they are the predominant form of acupuncture that's used today. However, let's take a look at some of these other choices, some of these non-invasive techniques. I had mentioned earlier, certainly the most simple of the non-invasive techniques, which is a simple acupuncture probe. These are called Tai Shin or Shoni Shin needles. So they're needles, but not really needles. They don't actually break the skin. So we just use these to add pressure to a point. There are also some spring-loaded ones like this one, which will help to modulate the amount of pressure that you might be using on a point. In addition to simply using pressure, we sometimes can use pressure over time. And so something very small, these are called BBs, these are actually called press balls, but we commonly refer to them as acupuncture BBs. They're very tiny, and perhaps you can see them here. They're maybe a millimeter in terms of a diameter, very small, and they're on little tape plasters. We can pull this off, and it's on a clear piece of tape. And these little acupuncture BBs, these little press balls, are placed on acupuncture points, generally on ear points. So if I put it on here, it's going to disappear very quickly. But if I put it on the piece of paper, perhaps we can see it. So these are generally taped down and usually used on ear points, sometimes used for very small children, to be taped onto an acupuncture point and left in place for some hours, up to some days. And so this small amount of pressure over long periods of time, especially on points that are particularly sensitive, like ear points or on small children, can have a very effective, can create a very effective treatment. Another bit of metal that's kept on a plaster, similar to those BBs, are magnets. And so magnets can be used to stimulate acupuncture points. These are 800 Gauss magnets. Magnets can be purchased in different shapes, different styles, different sizes, and different strengths in terms of Gauss. I think an 800 Gauss magnet is a fairly common strength of a magnet and the strength of a size. These are gold-plated magnets because they are intended to be left on the skin for some days in most cases, and so we want something that's going to be non-reactive. So we use these gold-plated magnets. The gold-plated magnets also come on a plaster, of course, so that we can stick them to the skin. You may be able to see that there's a bit of a bump on one side of this magnet. The other side is flat, and that will help us to distinguish between the north side and the south side, the bio-north and the bio-south side of the magnet. And again, these magnets are simply just placed on the skin and can be left there again for some hours to some days. One thing to always keep in mind whenever you're placing any metal in contact with the skin of a patient or putting a plaster, like a Band-Aid or any kind of sticky material, that a patient could react either to the metal or to the glue that's on the plaster. And so we need to tell patients to always be aware if it gets itchy, if it begins to turn red around that area, if there's any irritation, they need to then remove that and wash the area. Again, as I mentioned, these magnets have both a north and a south side, so they can be peeled off of the plaster and flipped over. If you wanted to use the other side, usually they come with the one side or the other facing out on all of the magnets. And you might have a situation, I'm having a little trouble, but I can probably get it. There we go, back in the middle, facing the other direction. So sometimes we like to set up a polarity where you would have the north side of a magnet on one particular point and the south side, for instance, on another point. If someone had tennis elbow, for instance, or golfer's elbow, we might want to put one side of a magnet down in the painful area and the other side of the magnet in a place, on a point, which will help to drain the energy from the area where it's stuck or where there's pain. So there are different ways that we can use magnets. By setting up that polarity, we can sometimes have a greater effect than just putting a single magnet on a painful spot, although sometimes even just a single magnet on a painful spot. Remember, when you wiggle a magnet, you create an electrical charge, and that electrical charge then gets transferred through the skin to the acupuncture point. Another less common way of using magnets, this is a set of non-invasive acupuncture tools. They look like acupuncture needles, but they are just magnets. One is a north pole, one's a south pole, so they want to attract one another. And these can be used in a similar manner to the magnets on the plasters, which I just showed you, to place one on a painful spot and one on a spot that may help to drain that energy from the painful area to a place where we can better move it. Okay. Some of the more modern approaches for non-invasive tools. This is a piezoelectric stimulator. It's a very simple tool. When we press on this little button here, there's a small crystal in here which is bent, and when it flexes, it puts off a piezoelectric charge. And if I place this against the skin, I feel an electrical charge right down. You can actually see my finger jump there when I hit that, stimulating that muscle and causing it to jump. And I can feel that energy travel right down my finger, right along the large intestine meridian. So this is also an effective way to stimulate acupuncture points without breaking the skin, a non-invasive technique. Another non-invasive electrical technique is to use something such as this Pointer XL2. There are a number of electrostimulating machines for acupuncture. Many of them are designed to work in conjunction with acupuncture needles. This particular machine is designed to work on its own, not in conjunction with acupuncture needles, but just to directly stimulate the acupuncture points, just like that. I think we could probably, I don't know if we can get that same reaction to show you, if I can catch that. You may be able to see my finger jumping. I guess not quite. But there is some reaction happening there. I'm feeling that electrical stimulation throughout the finger. So there are, again, various other electrostimulating machines, and we will cover them in another class. Another non-invasive tool is the acupuncture laser. This is a very simple laser. It's a 5 milliwatt, 630 to 680 nanometers. So that means that we're going to get a bright red dot that would be visible at 65 feet in a well-lit room. The use and the reasoning and the theories behind using laser acupuncture is covered elsewhere in this program, but I do want to show you that the application is very simple. Simply holding a laser on an acupuncture point for about a minute is sufficient to treat that point. And again, this is a fairly common non-invasive treatment for acupuncture points.